should talk about something kind of general in sleep, so I'm going to do that without all the sleep science and that kind of stuff that I usually give towards the docs. And if you guys want to know anything about that stuff, you can talk about it. But it's kind of boring and it doesn't really mean anything. So I thought I would just talk about how to get a good night's sleep. Because a lot of people do stuff that totally torpedoes their sleep. And the thing is you do really stupid crap. And if you would just stop doing one or two things, you would sleep so much better.
Okay.
You know, stupid stuff like when you wake up at night, don't turn on lights and don't look at the clock. Quit it.
Or your phone.
Cell phone goes to the kitchen to get charged. Or it sits in your bedroom only to be the alarm, and that's it. So, I'm jumping ahead. So anyway, so I thought, you know, I also call this talk Uncle Pat's Tips on How to Get a Good Night's Sleep. So, and I'm actually the medical director for a couple of sleep labs in Oregon, in Pendleton, Ontario, and then I also read for a whole bunch of labs, including this one.
Okay.
So, let me get back to my little control here. So, standard disclaimer, informational purposes only. I don't have any things to disclose, and you should really talk to your doctor, because I'm not your doctor, okay? So, it's just the worst not to get a good night's sleep. I mean, you feel crappy the next day, and you wonder if you're going to sleep good the next night, and it makes you anxious and kind of messes around with you. And she has no place to set for it.
I just want to be able to see.
Okay. We had to do this screen instead of that screen because the projector went out.
Oh, this works.
Anyway.
It does.
And so, you know, you're laying there and you're just getting anxious and you can hear every noise and stuff bugs you, you can't get comfortable. And this is the reason why people come to the emergency room in the middle of the night, truthfully. Because during the day they've got stuff to keep them occupied, but then nighttime comes, nobody's up, nobody to talk to, nothing to do, and that ear pain that's been bugging them all day takes them to the ER, okay? And they come for really, you guys know this, if you go to the ER in the middle of the night, they come to the ER for really stupid stuff, okay? Well, this is why. So there are lots of things that you can do, and you're going to hear me use this term quite a bit, but the term is sleep hygiene. So we have hygiene rules on how to eat, how to exercise, you know, keeping your body clean, all that kind of stuff. Remember, everybody talks about the rules how to get a good night's sleep, right? Okay. So, come on, baby. There you go. So, reasons why you don't sleep well: bedroom's just not very comfortable, you're too busy, you're not taking time for sleep. Mr. Edison, as well as TVs and computers and everything that came after Mr. Edison, they mess with your sleep. And even if you don't think they do, they do. And then also sleep disorders can mess with your sleep. And we'll talk about a really common one called obstructive sleep apnea, because it's important to know about, because it's not just snoring on steroids. It puts you at significant risk for cardiovascular and cerebrovascular disease. So, in the bedroom, you need a comfortable mattress and pillow. You know what? You're sleeping on that surface for a third of your life. Spend the extra money and get something comfortable. Don't cheap out. If you cheap out, you're in trouble. Now, you don't have to go with the Sleep Number bed that's going to cost you $6,000. But, although, you know, if you've tried everything else, that might be, there you go. But, I mean, you gotta be comfortable at night, or you're not going to sleep well. Bedroom has to be cool. Humans sleep better in a cool bedroom. They do not sleep well in a hot bedroom. The bedroom needs to be blacked out. It needs to mimic what we used to live with before the light bulb came along. You know, so your brain is not designed to see anything brighter than starlight after the sun goes down before you wake up again. And we're going to talk about that in a little bit too. You want it to be quiet. You don't want to have any distractions. It's okay to wear earplugs if you need to. Use a white noise generator to kind of take out ambient noises. It's okay to wear eye shields if you want to, okay? But don't leave the TV on and then wear eye shields, okay? It's a bad deal. TVs don't belong in the bedroom. We'll talk about that later. So you need to take enough time to get sleep. Children up to about the age of 13 need roughly 10 hours of sleep a night. Teenagers up to the mid-20s need 9.25 hours of sleep. None of them would ever say that they needed that much sleep.
Exactly.
But which is why energy drinks are marketed almost exclusively to them. And we can get into that too. That's one of the many soapboxes I stand on. And Thomas Edison truly is the father of all modern sleep disorders. After the light bulb came, it changed the way we sleep fundamentally. And the next person that screwed it up, I actually should add that to the slide, is Henry Ford, because he figured out how to, because he had electric light, he could fix it so people were working 24 hours a day.
Wow.
And so shift work, he's the father of shift work.
Mm-hmm.
Come on. Here you go. Did I get the other one? Okay, so there are roughly 80 to 90 distinct sleep disorders. There are even 95 now. I think it's just under 100 now. But some of the more common ones are obstructive sleep apnea, something called periodic limb movement disorder, and restless leg syndrome is a significant cause of sleep onset insomnia. And we can talk about those things. I'll probably just touch on obstructive sleep apnea because a lot of you guys work in offices and such, right? So you need to kind of know how to pick up on what going on with a patient would say, yes, you probably have sleep apnea, you need to go do something about it, okay? And insomnia. Insomnia is so multifactorial. It has to do with sleep hygiene, medications, any mental disorders, chronic pain, other medical disorders can cause insomnia. And so you have to ferret out all of those things instead of just saying, here's 100 milligrams of trazodone for you to take at night. Okay? Fix the underlying problem. Don't put a really bad Band-Aid on it. Trazodone's a bad sleep drug, so that's very common. And amitriptyline and some of the other sedating ones. So this is what I was kind of alluding to earlier, is you have a clock in your head, and it's a little tiny area of neurons just above your optic nerve, and all he does every day is look out through your eyes to see when sunset comes, and later on when sunrise comes, and later on when sunset comes. The brain only knows truly two events, sunrise, sunset. Those two events should happen about 15 to 16 hours apart, because that little clock thinks he lives 5,000 years ago around the equator somewhere. He does not know anything of being outside the tropics. He does not know Monday, Tuesday, Wednesday, Thursday vacations. He doesn't know Christmas. He doesn't know anything to, really crappy light schedules up in Alaska, or even here. So those things all mess with your sleep-wake schedule. All of your body systems are timed to that clock. Hormones, gut, kidneys, brain function, hair growth, fingernail growth, everything's timed to that clock. All major organ systems have their own clocks that want to time to him. He wants to time to the sun. The sun is the master time server. And so you can get a better handle on your sleep by manipulating your light-dark schedule. Okay? Get up same time every day. Get a good bright light signal in the morning to simulate your sunrise. Good bright light in your environment for 1 to 2 hours. Outside sunlight is best, but as you know, as we go from solstice to solstice, days can get short, they can get long. That messes with your clock. You toss in daylight saving on top of that, and it kicks your butt now, and it didn't when you were in your 20s, didn't it? Mm-hmm. Yeah. So it's just those minor things that can totally throw you off. And if you make that stable every day, you sleep better. Because light tells the brain when the wake system should come on and when they should shut off. Sleep is totally controlled by a totally different mechanism. Sleep is controlled by how long it's been since you slept. And if everything's working right, that all looks like one system, but it's actually 3 different cycles: light and dark, wake, and sleep. So if you time them right, you sleep better. So other things that can kind of tell the clock where it lives is exercise, particularly if you do it in the morning or at midday. You don't want to do it at night because that can affect your sleep later. Eating can do that, and behavioral stimuli like social interactions and things like that can kind of tell give your clock some minor clues, but by and large, light's the way to do it. And so what I was talking about is sleep pressure and sleep debt. You tend more to fall towards sleep with the more sleep debt you build. So in other words, you wake up in the morning, you start building sleep debt, and it keeps building and building and building until you sleep again. That is, who here has some chemistry or biochemistry in the background? Anyone? Anyone? Okay, so I won't go into that. Basically, a chemical builds in your brain called adenosine, and he tells the sleep-wake switch, you should probably tip towards sleep, because you've got a switch in your head. He is not an on-off switch like a light switch. He is a teeter-totter. So if you have a lot of signals that say go to sleep, you go to sleep. If you have a lot of signals that say go to wake, you go to wake. Which is what, and that little chemical is why you cannot stay up past about 3.5 days. You can drink all the coffee you want. Coffee, by the way, blocks that signal. So caffeine's a real important thing to think about, because that iced tea you had with dinner just screwed your sleep up that night. Okay? It's out of your bloodstream in 6 to 8 hours. It's in here for 10 to 14. Okay? And so it blocks this adenosine signal from being able to get the sleep-wake switch. Okay? But if you go far enough, 3.5 days, you can drink all the coffee you want, block those receptors. Adenosine gets so high that it just knocks all the caffeine off and you crash. That's why you're going to crash sometime. So the people that come and talk to you and they say, I haven't slept for weeks. Now we know that's not true. You have to be sleeping. It's physiological. It can't not happen. Because see, sleep, it's interesting that the emerging theory of what sleep does is, and I've already talked to Crystal a lot of this stuff, she's already
It was a good talk last night.
Sleep actually keeps your brain from growing too big for the brain bucket. So when you fall asleep, the brain actually shuts off cortical activity, so it shrinks slightly, it starts to cool, and dreaming sleep then comes in every 2 hours and starts nipping nerve connections you don't need anymore. And so the brain shrinks even more. But during the day, the brain grows again because it's learning new things, it's experiencing new things, it's recording new things. If that doesn't ever, if that pruning and stoppage every once in a while to let the brain shrink again never happens, it's going to kill itself because it grows too big for the enclosed space it lives in. So those are all things you kind of think about, and it's very complex. But basically, if you just get in a rut and stay in it every day, you sleep better. Because, so you say you have a crappy night, and I mean you didn't sleep a wink, you still get up at your target wake time, you still get your bright light. You don't crutch with caffeine and taking a nap in the afternoon. We'll talk why naps are bad.
They're bad?
Yeah, they're bad. Unless they're any, so we'll talk about how to nap if you absolutely need to take one. But guess what happens the next night? You're going to sleep way better because you're going to be more sleep deprived, right? And everybody thinks, well, if I don't sleep, something bad will happen the next day. And you start trying to pin them down on what that bad thing is. They don't know what it is. You know what the absolutely worst thing could happen if you don't sleep well one night? What's the absolutely worst thing that could happen?
You're tired the next day.
Duh, you're sleepy the next day. And guess what happens? You sleep better the next night. So to do it the same way, all of a sudden it starts evening itself out, and you give your best chance of getting night's sleep. Will it be perfect every night? No, it will not, because last time you were the world's most perfect sleeper, you were 12 years old. It's all downhill from 12. Okay? So sleep hygiene is kind of what we've been talking. It's just a rough set of guidelines to help you get a good night's sleep. It helps with depth of sleep and quality of sleep, and you can totally adapt it to what's going on in your life if you just realize this is how the brain approaches it, like we've been talking about. So a no-brainer, only go to sleep when you're sleepy. Don't go to bed and try to fall asleep when you're not sleepy. You're just going to lay there and get worried about not sleeping, which makes it worse, right? Okay? Get your butt up out of bed and go do something boring. You know? If it's past your bedtime, don't do it in darkness. Stay in darkness. Because see, it's interesting that sunset period is where the brain releases melatonin. Okay? Melatonin does one thing and one thing only. It leans over to our brain and says, brain, it's dark outside. Go do what you do when it's dark. Okay, so in us, humans, that is to start this complex neurologic dance, which is called sleep. Cats, bats, and rats, what's it do to them? Tells them to start their day, right? So melatonin is not a sleep aid. It is a timing agent. We are the only country in the world where melatonin is not prescription only. And that, but most of the melatonin you find over the counter doesn't even have melatonin in it. And if it does, it's from bovine brains straight off the slaughterhouse floor, and it's never been screened for prion disease or retroviruses.
Wow.
So you're better off doing, most people do, some people, come in taking 10, 15 milligrams of melatonin. Adults should never have more than a milligram. And it must be timed in that hour before your in-bed asleep time. So that's your dim light period, that's your sunset. So you take it here, what it does is augment your own melatonin. Now if you get light in this period, you actually suppress the melatonin, and that tells the brain, oh, well, sunset didn't happen, we must need to move later to the next night. And so it's those bright lights, and we'll talk about how light controls the movement from one time zone to the next, and how it affects your sleep. Or at least I think I do, I don't remember if that slide's in there or not, but we'll get to it. So you don't want to lay in bed just getting more and more worried about sleep, because what you will start teaching your body is that the bedroom is not a good place to get a night's sleep. So you get your butt up out of bed and you go do something else. When you are actually falling asleep, you're not fatigued like after exercise, you're not just tired. I mean, you're actually having trouble, your eyes are rolling, you know what I mean, sleep onset stuff. Then you can go back and get in bed. If it's 15, you estimate about 15 minutes, never look at a clock, but estimate about 15 minutes, you haven't fallen asleep, you repeat that. You keep repeating that step until you fall asleep in bed. What's going to start happening is you'll start falling asleep in bed, especially if you're watching your light dark. Okay? So just like I was saying, so you can go do very low light level reading. Okay, you don't want 12,000 lux lamp bouncing off a page into your eyes or anything. You do not want to use a Kindle that's got a backlight. Okay, you use an analog book or use an old style Kindle that doesn't have a backlight that you're using a very mild reading lamp for. Okay, yeah, they showed when the Kindle Fire came out, in about 3 or 4 months, a study showed that people reading at night with their Kindle Fires were shifting their clocks into the evening 3 to 4 time zones. And so they started not being able to fall asleep until later and later. I still had to get up at 7 or whatever to go to work. They were getting super sleep deprived. So that's something you have to avoid at night is light exposure. You can listen to music, listen to a book on tape. You know what I do? I go turn on NPR, middle of the night. It's the, what is it over it's the guys in England. The
BBC
guys,
yeah.
And they're so freaking boring. They just drone on about stuff you don't care about anyway, and you get sleepy. Okay. You can practice the relaxation techniques, and there's a bunch of stuff out there about practicing mindful meditation. Those kinds of things work. What you don't do is go sit in bed and finish all the work that you didn't do. Get on your laptop and start paying bills or paying taxes or doing any of those things, because all it does is jazz your brain up, engage your wake systems, and you can't shut them down. Okay? So, in general, you don't take naps. And the reason why is, remember I told you about adenosine and how it starts climbing in the body. Every time you nap, you clear a little bit. Nap, clear a little bit. And so instead of reaching its peak, so that you tumble into sleep correctly, you don't have very much pressure to sleep. So you may get to sleep, but you're not going to sleep well that night, okay? And if you absolutely need to take a nap, never longer than 20 minutes, because you don't want to go into REM, okay, dreaming sleep. If you do that, that's called doing one sleep cycle, and that automatically decreases your, even if you can fall asleep at night, you're not going to sleep as well, okay? And you never take a nap after your wake time plus 8 hours. So if you get up at 6, no naps after 2. If you do that, you're going to mess with your sleep that night. So, yeah, okay, so I did put the light thing in here. So in the morning, make sure you get sunlight level light for about an hour to 2 hours, and within the half hour of awakening. I just say the best thing to do is come out of a completely dark bedroom and walk out into light. You can do that easy in the summer. You have to create it in the winter, okay? So the idea is to create your own sunrise and your own sunset and follow it the same way every day. Oops, why did you do that? There we go. So in the evening, you dim the light down about an hour before you're in bed asleep time. So the basic idea is wake time is most important. So I didn't even do anything here. Let's go back, quit it. Wake time is most important. You get up same time every day. Then you calculate backwards what you need. So anybody above about the mid-20s or so need at least 8 hours. When you get about late 50s to early 60s, that'll drop to about 7.5 hours. And in the 80s and 90s, they may be only able to get about 7 hours of consolidated sleep. But you try for 8. So you count back 8 hours. That's your in-bed sleep time, not, oh, Dr. Plummer said I should go to bed at this time, so I guess I'll get ready now. No, you should have been doing that an hour ahead of time and dimming your light and creating your sunset, okay? so that melatonin knows when to secrete. So, and I say here 6 to 7 p.m. You want to kind of watch real bright light stuff, just because you're going to be like you're going to go out to a ball game in the evenings or something like that, and it's near solstice and it's still brighter than anything outside. Probably should put on sunglasses to help kind of start dimming the light to your retinas. You avoid all your screens, okay, and you don't turn lights on when you get up at night. Night lights are also bad, but we found that if your night lights are red, they will not affect the clock. Because blue is what talks to the clock the best. Do you know why blue talks to the clock the best? Okay, which maybe I should say, do you know what color of blue talks to the clock the best?
Sky blue.
Absolutely, because eyes have been staring at sky blue skies for millions of years. We've only known that about 10 years. So, get up same time, go to bed same time, 7 days a week, 24/7, 365. Doesn't matter. And so wake time is most important, we talked about that. Because avoid exercise within 4 to 6. If you're having trouble falling asleep, I say 6. Way you can trick your brainstem into thinking it's time to go to bed is about an hour ahead of time. Go take a really hot shower, raise your core temperature 1 to 2, or maybe 2 to 3 degrees. Get out real quick, do a quick towel off to cool down rapidly. Which is why when you go sit in a hot tub for 15 minutes or so, and you get out, kind of a cool breeze, towel dry off, you go inside, what's the first thing you want to do? You just tricked your brainstem into thinking that sleep onset should occur. Because at sleep onset, your temperature starts to drop. Okay? So gentle movement, relaxation exercises are okay. So Tai Chi, yoga, those kinds of things are okay. They're not going to mess with you. But for heavy duty exercise, morning and midday is best for the clock. So just getting this all into a ritual just really, really, really helps the body pick up signals that it's time to do what it needs to do at night, and we already got it. And sleep doctors will tell you, bedroom is only for sleep and sex. You don't go in there to watch TV, you don't go in there to play on your computer, you don't do anything like that. The lights go down, and that's for sleep. So you really want to watch nicotine. Nicotine's an interesting drug because it disrupts sleep when you give it, and it disrupts sleep when you take it away. So in a nicotine-naive person, you give them nicotine, blows their sleep up. You have somebody who's habituated to nicotine, you take away their nicotine, blows their sleep up. Okay? It's really about the only agent out there that does that. Caffeine, we talked about that. First thing in the morning, if you're going to do it, chocolate, same thing, although chocolate doesn't grab those receptors quite as tight. And alcohol is interesting in that it can help you get to sleep, but as it's metabolized, it starts waking you up and disrupting your sleep. So that's something to watch for. And interesting thing about girls is that if girls have mild to moderate doses of alcohol during the day and they let it metabolize before they go to sleep, and they have sleep apnea, it won't make their sleep apnea worse. But in guys, any time of day they use alcohol, even if it's been metabolized, their sleep apnea is going to be worse that night. It's because you guys are wired different. So you want to stay away from OTC sleep aids unless you're using them just here and there because they're all Benadryl or one of its friends. And within a week, you become tolerant to that side effect. 2, you're using a side effect to get what you want. And you must not equate that to good sleep. And by a week, it's already changing your sleep architecture and suppressing dreaming. Okay? So not a good thing. And melatonin we've already talked about. So before bed, you don't go to bed hungry. You know what the really good thing is? A warm glass of milk, actually, like your grandma used to say, it works because it's got tryptophan in it. It's protein, it's got some protein, a little bit of sugar to take care of your hunger, but also give you a long-term energy source. 2 tablespoons of peanut butter do the same thing. And it has a fair amount of, so if you like peanut butter and you're not allergic to it, then don't come back to me, like the lady that said, I burned myself with a hot cup of coffee,
Oh, yeah, right.
And you don't want to eat heavy before sleep because, one, that'll make your sleep apnea worse, but it will disrupt your sleep. So.
Is that like last night, Doc?
Yeah.
Right.
Yeah, exactly. I think the 7.5-hour car drive prior to the and so we did the hot bath thing, rapid heat, we did that, we talked about that. So sleep apnea is an important reason why people don't sleep good. You know, your typical guy is gonna be a guy, he's overweight, he's born 50, he may have high blood pressure, those kinds of things, but don't be fooled. Because the ones that you're picking up that are moderate to severe, you're missing a lot of the other people that need to be treated, okay? So don't be fooled. Young and skinny people could have sleep apnea too, because it's not just a weight thing, it's an airway shape thing. And your family is what gives you that airway shape. So if you have a low BMI young adult who starts having problems with high blood pressure, it's sleep apnea until proven otherwise. Even if they don't snore, you check that out. So see what happens in sleep apnea is normal breathing when you're on your back, these tissues kind of stay out of the way and you've got an open pipe here. But because of architecture reasons or because of weight, when you're sleeping at night, these muscles all relax and the airway can collapse, and typically it's at the end of a breath. So those people have a little more crowded airway, they may have big tonsils or a lot of excessive tissue like because of weight, big uvula, et cetera, et cetera. So what happens is, let's see if this even works, I don't know if it will. So at sleep onset, person starts to snore, and they relax a little more, airway collapses. At the end of a breath, they go to take a next breath in, breathing is obstructed, and so it stops. And then sleep gets disrupted and airway pops open again. Okay, and that just cycles all night long. And so these people have to stay in a very light, they have to keep coming back in a lighter stage of sleep, get their airway back. They don't sleep good. You might as well, you wake up feeling like you might as well not even gone to bed that night, essentially. So you'll see snoring with pauses in breathing, although you don't have to snore, and that's the big rip. Gasping and choking, people talk about sleep just being really restless. If you have a postmenopausal woman who may or may not snore but has sleep maintenance insomnia, postmenopausal and sleep maintenance insomnia alone, you should check them out for sleep apnea. Because they're once a lady goes postmenopausal, her risk for sleep apnea starts to rise. So yeah, we did that, and they get sleepy and they just feel like bread the next day. They're irritable, depression's tightly linked with sleep apnea, memory loss, you can't concentrate because sleepy brains just can't do stuff very well. You can't, you read things 5 and 6 times to get them in your brain, you're irritable, your mood changes more often if you have chronic pain, your pain is always worse, the whole thing. Morning headaches is always thought to be a classic symptom of sleep apnea, as well as hypertension. And so high blood pressure is totally tightly linked with sleep apnea. Guys have to get up and pee all the time at night. And in fact, a lot of those guys that come in, I have to get up and pee every hour. And doc keeps saying it's prostate, but none of the prostate meds are working for me. We find out they have really bad sleep apnea. Treat their sleep apnea, they don't want to have to get up and go pee, and we can talk about the reasons for that. It's like they're more happy about that than how good they feel during the day. They don't have to get up and pee anymore, they want to come hug you. It's like, and especially men, ED is a real problem for them. And if you treat it, it really, really helps with that. Studies are showing that big time. So this is old data, but a huge study, just a population study. At least 4 out of 100 middle-aged men have it, at least 2. So we know there's of women have it, but we know that those numbers are probably higher than that, and probably about 90% of cases are out there walking around undiagnosed at this point. We say 95%, but it's a lot more ubiquitous to look for it now. We look for sleep apnea a lot more than we did even 10 years ago. But males are definitely more than females, at least at this time. So you see high blood pressure. These guys are at increased risk for heart attack, heart disease, especially congestive heart failure, stroke. 70% of people who have had a stroke have sleep apnea that needs treatment. 70%. That should be in your care plans, in your EMR at the hospital. Somebody comes in with a stroke, send them to be evaluated for sleep apnea. It should just flag. Same thing for heart failure. 40–60% of people with heart failure probably have sleep apnea and they don't even snore. And they won't complain of daytime sleepiness. Plus accidents from sleepiness, job loss from sleepiness. I have this guy who came in, very bad sleep apnea, came in, started using his CPAP machine, changed his life. He loved it. Came in for a second visit, and he said, I'm mad at you. I said, why? Using the machine, we fixed you, you feel better? He says, yeah, I get all of that, but I'm still mad at you. He went to work one day, he's the boss, and everybody in the office kept kind of looking at him this way, whispering, to their colleagues, and just kept looking over it. And about halfway through the day, he just looked at them all and said, what? What's going on? And kind of the office spokesperson kind of came towards him and he said, we think something's wrong with you. And he said, why? And he says, you laugh at our jokes now. You don't yell at us anymore. You're taking happy pills or something like that. He no way knew that he was treating people that way. He was super embarrassed, and that's why he was mad. And so these sleepy brains don't know that they're doing that to them. They're acting that way. So the way we look for is do a sleep study, and you call Crystal. She knows everything about it. But basically what we do in a sleep study is we look at your brain waves, we look at muscle tone, we look at your heart rhythms, we look at all the respiratory things, how well you oxygenate, if you're moving your legs at night, and so there are sensors all over your body. I think I have a picture of a guy with his. So we have belts on your chest and your abdomen to look at how your chest and abdomen move with breathing and if you're fighting to breathe. And a lot of patients really come in and ask this a lot. They think that we're recording their thoughts and their dreams.
Oh, no.
It's really scary to them. And they won't ask you unless you just tell them, no, we're not doing that. And so the way we treat sleep apnea is, basically you can think of this as an old radiator hose. Oh, no, that's the guy, that's the one I use with guys. The analogy I use with girls is you're sitting around with your friends and you're just drinking Cokes. And what you do, you're done drinking your Coke, but you're just chewing on the straw and chewing on the straw while you're talking to them. How the straw gets all soft and flat and floppy, right? Okay? You take that straw out and you suck on the good end. What happens to the flat end? And no matter how hard you pull, all it does is suck it tighter shut. But if you take that straw, flip it around, and blow through the flat end, what happens? Reinflates and you reestablish flow, right? Okay. Physics of a floppy tube. It's called Stalling's principle. And so if you have a collapsed tube that's having suction applied to it by the lungs, if you apply upstream pressure to that tube, you're going to open it up and hold it open. That's what CPAP is doing. Okay? So that's how it works. And it doesn't breathe for you, it doesn't give you oxygen, it doesn't do anything like that. All it is the wrong end of a vacuum cleaner put to your face, controlled by a computer. And I tell all my patients, it is not a natural act to put the wrong end of a vacuum cleaner on your face and go to sleep. But it is totally learnable. And when you learn it, your brain will not let you go back.
The people who wear them, they love them. If they can wear it long enough to see the benefits, they take it everywhere they go. If they go out of town, they take it. If they go camping, they take it. And then the other ones are like, I can't handle it. But if they could try.
And you have to work with them and work with them and work with them until you get them there, but you will get them there.
And they do feel better, and they start to lose weight, and they get more energy. It's amazing to see the transformation, really.
I have this guy who, very bad sleep apnea, had a heart attack. And, all my patients have really bad sleep apnea. He'd had a heart attack, and that's why he got referred by his cardiologist. And we got him started on CPAP, and he comes in 3 months, and he uses it every night. I mean, all night, every night. Whenever he's asleep, he's got the machine. Then he comes in and goes, I'm using that damn machine all night, every night, like you told me to for my heart attack. I don't feel any different than I did when I started. And you can tell by looking at him, he feels better because he's more awake and he's more energetic, he talks more, the whole thing. Well, he had to go to Pendleton, from Ontario to Pendleton. You have to drive through the Blue Mountains to get to Pendleton. And it was late November. And he thought he was going up there for a business trip. Thought he'd go up for the morning, do the business trip, drive back. Snowed in the blues. Got stuck in Pendleton for 3 days without his machine. Got a little snapshot of what he used to feel like. Now that sucker is in the trunk, even if he thinks he'll get stuck out of town. Because it's better for him to have to tear it down, put it up again, than to be caught somewhere without it. Now there's other things you can do for sleep apnea, but body positioning for those people who only have sleep apnea on their back, when they're on their back. weight loss obviously helps, but a lot of these things are not curable unless the sleep apnea is very mild, okay? And so that's why we say, you know, a lot of dentists out there say, well, I'll just put this thing in your mouth and I'll cure your sleep apnea. No, not really, because it's not merely good enough to be better. Even mild sleep apnea, 10 to 12 events an hour, puts you at 3 times the risk for high blood pressure, stroke, heart attack, heart failure, dying early. You bring somebody down from severe to moderate sleep apnea, they're still at risk for all those things. They need more. It's not merely good enough to be better. You want that number of apneas per hour to be below 5 an hour. You think that should be 0, right? But just like hot dogs, you know, hot dogs are allowed to have a certain amount of ground glass and rat hairs in it. You think that those numbers would be 0, but they're not. Okay?
Well, you were saying yesterday that those oral appliances are really, really expensive.
They can be. They're definitely a moneymaker for the dentist, and that's why they want to get into them. And really, the only ones that are really trained to do it well are the dental sleep medicine specialists. And that takes a lot of training. You've got to take a board exam and everything. And so those guys are pretty good because they know what they can do and what they can't do. Dentists that just want to get into it, take a couple of courses and go, well, I could do that, you know. They don't understand what's going on with sleep apnea, and they may be actually harming patients by doing that because patients think they're fine, and they're not fine. So a good book that you should think about is by Dr. Dement, Bill Dement, who is felt to be the father of sleep medicine. He started the first sleep medicine program at Stanford with Christian Gimeno back in the early 70s. He's written a great book called The Promise of Sleep. I, of course, have an autographed copy. But it's very down-to-earth written, and just has a lot of interesting stuff about not only history of sleep medicine, but the different kinds of sleep disorders, sleep hygiene. It's just a really good read, and it has a lot of cool information in it. And you can probably get it, you know, used on eBay or whatever for a song. It's a good one. And then this is the sleepeducation.org is a nice site because it has a lot of stuff about sleep, and it's sanctioned by the AASM, the American Academy of Sleep Medicine. So those are good. Those are good information things for you guys. I'm about to lose my battery here. And so who to contact? Your doctor, okay? And if you can't get satisfaction there, you talk to Crystal. Crystal knows everything. And so do you have any questions?
That was great.
Oh, thank you.
I have a question about the
Well,
home.
then she had her hand up first. No,
Sorry.
I didn't know if you were looking at Crystal.
I'm looking at you.
Anyway,
So she started to go like this, and I glanced over her.
I have 2 questions. Do you think there's a correlation? Like, I feel like when I'm in a recliner, I sleep a lot deeper. And then I get up to go to bed because I'm so tired and I'm sleeping so good, and then it's ring, and I wake up.
Here's the deal with sleeping in a recliner. People with sleep apnea or other sleep breathing disorders, because girls can also have a sleep disorder, a breathing disorder called, we call it upper airway resistance syndrome. So it's kind of the same thing as sleep apnea, is the muscles relax and let the airway start to collapse. But it's more akin to just breathing through a straw that's getting smaller and smaller and smaller, and you're working harder and harder and harder and so you have to come up into a lighter stage of sleep, get tone back in the muscles, dilate the pipe back open, so your workload goes down. And so you stay in a lighter stage of sleep there, and you get very sleepy. But the thing is about sleeping upright, it introduces a concept we call tracheal tug. So in other words, your weight tends to sink, your diaphragm can drop, your lungs can drop, and it puts tension on the trachea, the windpipe. That also tenses these tissues slightly and helps stabilize them. And so it can decrease very slightly the severity of sleep apnea and help that way, but there may be other reasons why a recliner does well for you.
Okay, and then my other question is, what exactly does Ambien do? I can take 2.5 milligrams of Ambien, and I don't take it every night, just if I'm really having trouble sleeping.
Well, you're kind of talking to the wrong guy because I'm not a fan of Ambien.
I'm not either, I'm
So
trying to figure out something else to try.
Yeah, so it depends on whether you're having problems with getting to sleep or staying asleep, and or both.
Mostly getting to sleep.
Yeah, so you're better off doing something like something really short acting. And so there's a medicine out there called Zaloplan that is in your bladder by 90 minutes. And it gets you there and then goes away. It doesn't affect your airway. The problem with Ambien is that even though they tout it as being a non-benzodiazepine, a Valium class drug, totally acts like a benzo. And so it's gonna relax your muscles more, and it makes sleep apnea worse, okay? Really, the only two that, in those classes that don't, are the Zaloplan I talked about because of its ultra short action, and one called Lunesta, or what used to be called Lunesta is called Zoclone. Zoclone doesn't appear to mess with because it's more highly selective for the little receptor in your brain than these other drugs. These other drugs are like elephant guns. So the Valium class drugs especially, they really mess with sleep. And the problem with sleeping pills in that class is it tends to it makes your sleep more continuous. It tends to keep your sleep lighter. You don't go into that deeper non-REM sleep that you really need for restfulness. But it makes your sleep more continuous, and that's what people equate to good sleep, but really it's not. So you're better off following these rules and not having to use any. Oh, girl, always lean on your own neurochemistry than somebody else's idea of what your neurochemistry should be.
I totally do.
Yeah.
I totally heard. And then what about hormones? As far as
The problem with girls and their hormones, the thing is that once, well, no, what I'm saying is that whether or not you have hot flashes and things like that, those events, subclinical events are happening in your body, no matter whether you want them or not. You may not get the full-on, I can stand out in a midwinter blizzard in my nightgown going like this, sideways snow. Oh, I should have taken video. My mom came and she was hot flashing like crazy because she'd just been treated for breast cancer. And so she can't have estrogens or anything like that. And she was on anti-estrogen. She was miserable. And she's standing out, it is freaking 3 degrees outside, sideways snow, wind out on our back patio area, going like this in the middle of a snowstorm. So anyway, but those events are happening. I digress. So those events are happening no matter what, and they're disrupting sleep. Problem is that HRTs that make that better. And so your best move is to follow the rules. Will it be, like I said, will it be perfect every night? No, it will not, but it will give you the best chance of having a more consistent night's sleep. And Light Dark plugs into that more than you know. Oh, night shift workers are so hosed. They are so hosed. They really are. And even if they do it right, they still have an increased risk of cancer, prostate cancer in men, breast cancer in women. Those others sex linked. Okay, that's important. You're going against your biology. Mother Nature is having something to say about that. We are meant to be day workers. We really are. So what were you going to say?
So yesterday we were talking about the home sleep testing equipment. And
Did you get that email I sent you about that? Okay.
I did, thank you. I'm going to forward that on to the physicians. They wanted us to change our orders just a little bit, which we're going to do. But the home studies, so I had a patient do a home study, and then came back for the second night in our lab to do the CPAP titration. Found out that the pressure that the home study said that she should be on wasn't adequate for her.
Home study should have never said anything about pressure.
I know it did, somehow. So when she came in,
Any
she came
actual
in for an
pressure
oxygen.
settings?
No, she came in for an oxygen study. That's what it was. I think you remember this one. So she came in and she was like at a level of 13 CPAP, but that wasn't enough, and they had to move her up in the
Oh
middle
yeah,
of the
Travis
night.
took her up a centimeter.
Yeah.
Mhm.
So how do you combat that with the
Well, like I told you,
physicians or-
what you do is when they order the study, they have to show you a 30-day download that shows that their number of apneas, that the sleep apnea is controlled, and that the patient is using their machine compliantly.
Okay.
If that shows that, they come to the lab and they stay on that pressure or whatever pressure setting. So if it's auto 8 to 12, they come in, you set the machine auto 8 to 12. They come in straight ahead 13, you set them 13. They're on bi-level, set them bi-level. They're on ASV, you put them on ASV.
And
Okay,
put them
exact
on.
thing, and you do not touch the pressures that night because you have already proven they're in chronic stable state or whatever.
Gotcha.
And so all they do, and then Travis or Shane, they just watch the patient, and when they hit that 5-minute mark of below 8, how they do that on an ongoing basis, that seems odd. Because I've had the case where somebody show up at the very end of the test, and they have 5.3 minutes at 88 or below. what do you do with that patient? Do you report them as saying, you need oxygen, but we don't know why, or we don't know what because you didn't have a chance to titrate them. And I mean, you're gonna have edge cases like that that are gonna be really hard to deal with. And apparently, you will have more than just about every other lab I deal with. I know. So, we've gone round and round about this, so. It's okay, we still love Crystal.
I feel bad for him. I'm emailing him all the time, like, oh, what about this, and he gives me like this much information. Good, okay. Am I right?
Well, I'm just trying to tell you how to do it.
Yeah, it helps.
How to not get stuck. So how did we do on time? Hey, 10 minutes early.
Can I just ask?
You can ask
I
anything.
feel like if the TV's on, that's the only way I can go to sleep. My husband's kind of just the opposite, but
You've so
bad
learned to
habit.
it
do
takes me
that.
like 6 minutes to go to sleep.
Well, then why,
But if
so
it's
what
on,
do you think about what is it about the TV that makes you feel that way?
I think it just shuts my mind down of everything else. I
So
just
why
hear
couldn't
it.
you listen to the radio?
Yes, I could.
It's the noise.
Because audio doesn't shift your clock. It's the light that shifts your clock. And the problem is that you don't even have to have your eyes open to pick up that light information. You have light sensors on your forehead, your cheeks, your neck, your upper arms, your shoulders. In fact, you have those sensors all over your body. They're just in highest concentration right here. They're in very highest concentration in the retina, obviously. But see, you're picking up light information, so you can have a sleep mask on, still pick up that light information. It's going to affect your clock. So the idea is to have your sleep pressure build up to its peak, just right when the wake systems say, bye, we're done. You'll tumble into sleep correctly. Because see, what you're telling me is you can't shut your brain down. That tells me your wake systems are still on. Okay? So that means your clock needs to move a little bit this way. Because when you're in the light here, it keeps trying to move your clock into the evening a little bit.
I see.
Oh, and we didn't talk about that. So this is how you change. So the control points for moving to a new time zone are light exposures around your bedtime and light exposures around your wake time. So if you get a light exposure earlier than your normal bedtime, it's going to move you 2 to 4 hours into the morning the next night. If you get too much light here in the evening, it's going to move you 2 to 4 hours into the evening the next night. So this is tantamount to going to the east or west, okay? East is least and west is best. It's always easier to go to the west moving time zones because you can delay your bedtime. When you go to the east, you always have, and she knows this from coming from Nepal to here, oh, your clock is screwed up way longer than when you go the other way. Because you're asking your body to go to bed. Once you're cycled there, you can come back here, you're asking your body to go to sleep in the middle of its wake signal, and that's just not going to happen. So.
You were talking about the adenosine is the tipping point? Is that what you were saying?
Well, adenosine starts building in the forebrain, and that's the sleep side of the sleep-wake switch. Okay, so adenosine starts to build, and whenever you sleep, you clear it. If you sleep normally at night, you'll clear it all the way. Now, and that's not with any other neurologic things going on, that kind of thing.
So do they not give a drug that would?
Actually, interesting point. They are looking at some adenosine receptor and agonists that should be able to do that. But you can also, I mean, you can do it naturally by avoiding anything that blocks that signal and timing up your sleep-wake cycles. So see, that's when those two things are misaligned in any way. That's where insomnia on the front side or the back side of sleep comes from. The idea is to be timed. Rule number 7, timing is everything. I won't do that. I won't tell you the 8 rules on how to get along with Dr. Plummer.
No, I liked it
You want to know
yesterday.
you want
I think you should
the
tell
8 rules on how to get along with Dr. Plummer. I tell all my patients it's right at the end of their first visit. So rule number 1 states Dr. Plummer is always right. Rule number 2 states that if you're concerned that rule number 1 is an error, see rule number 1. Rule number 3, minds are like parachutes. They only function when open. Rule number 4, get on the horse every night. Rule number 5, I reserve the right to change my mind at any time. Rule number 6, always do your best, and remember your best is better on some days than others. Rule number 7, timing is everything. Rule number 8, whining is unbecoming. I'm done.
Can you tell me why you're not a big fan of Benadryl?
Benadryl?
Talk to me about Benadryl.
Okay, so Benadryl, what you're asking from Benadryl is to use its sedative function, a side effect, to get what you want. And what you're doing is you're talking to the wake side of the sleep-wake switch with an antihistamine, okay? And so the antihistamine talks to the sleep-wake, and it's a side effect thing that makes you drowsy and sedated, but it doesn't make you sleep, okay? So if you're using that once in a while, just, you know, for every once in a blue moon, you just have trouble going to sleep, I don't have a problem with that. If you're using it every night, you're screwing your sleep up.
Okay.
Because, again, remember, it's always better to lean on your own neurochemistry.
Okay.
Because your brain knows what to do if you will let it do so. You
So
just have to
follow
give it
the
right
rules.
signals. Follow the rules.
Follow the rules.